Hi, I'm Dr. Sarah Narji. We'll be talking about liposuction. Liposuction's great. There's just no other way to say it. There's nothing else in plastic surgery that you get that kind of change with no scars. So what liposuction is the removal of fat without removal of skin. There's long, thin metal tubes that are inserted under the skin surface, and the fat's sucked out through a vacuum mechanism without injuring the skin surface at all. So the perfect person for liposuction is somebody that has a fat distribution that's out of proportion with the rest of their body. They're either generally fit or they're generally happy with their body, even if they weigh a little more than maybe they'd like to. They're generally happy with most of their body proportion except their belly fat or love handle fat or arms, thighs, maybe the saddlebag fat on the sides of their upper thighs. Whatever the area is, every body is a little bit different and people carry fat in different areas that's genetically programmed. Very few people have perfect fat distribution from head to toe. So liposuction's terrific because you can suck off that little bit of extra fat in those isolated areas and make it smooth and even with the nearby areas that are a thinner layer of fat, and really do a lot of sculpting to a person's body, and that's their new body shape. They'll gain and lose weight in that new body shape. The fat doesn't come back magically to some other area. It's not that liposuction doesn't work or that it's temporary. It permanently removes fat cells, it permanently changes the shape of your body and changes your body proportion. And that fat does not come back unless you gain weight. Now, sometimes people have a trouble spot, me included. I had liposuction right in my lower belly love handle area. And if my pants were tight, I knew I was gaining weight and it was time to eat a little less. I had liposuction, my waist was thin, and I didn't notice when I gained 5 pounds quite easily. So you have to pay attention to that and realize that this is your new body shape, and just if you maintain the same weight range, it's not going to come back anywhere. Procedure and downtime for liposuction is really difficult to answer because it's super individual. If you have a really thin gal that just has a teeny area of fat on her outer thigh, it's not going to hurt very much, and there's not going to be a lot of downtime just to shape that down. If you have a little bit heavier, guy or gal, men do this a lot of the time too, and you're doing the entire waist and abdomen, flank area, low back, maybe some bra strap back fat, it's a bigger area, more bruising, more pain, and sometimes it hurts. It does hurt. It hurts. It seems to hurt on the flanks a little bit more, and while there's no cutting and sewing and stitch line that you need to protect, so there's not real restrictions in activity, meaning you can still work out, you can still go running. You may not want to for a little while, so a few weeks off, it really, really, really depends. So I make sure that each person comes in, I see them in person, we talk about exactly what areas are bothering them, and I can give them a realistic idea of how many days off from work that they're going to need to take or can anticipate taking, and what kind of activity restrictions they're most likely to have when they're going to be feeling ready to be back to their normal workout routine. I do liposuction with just about every procedure I do. It's done with a tummy tuck a lot, so that if I'm taking the excess skin off the front, I'll do liposuction on the love handle area to kind of really help define the waist even more. But honestly, when I do breast augments, if women have bellies that stick out a little bit more and are flat chested, having breast implants for their upper body and a slimmer waist really gives them a different body proportion, and it looks great. Almost everybody has an area of their body that has a fat distribution that bothers them, men and women. With men, it's little lower abdominal fat, love handle fat, man boobs. Women, it can be a whole range of areas, thighs, abdomen, love handles, under the chin too. But they're used to dressing in certain types of clothes to suit this trouble spot that they have. wearing, for example, tops and skirts instead of a full-length dress to a formal event in order to cover up little love handle rolls and stuff to make that look better. I think when you've had liposuction and you have a new shape, you just suddenly don't have that trouble spot anymore. It's gone. It's gone. The issue's over. You can buy the things that you wished you could buy before. You look great in slim fit dresses and bathing suits, and you know, men feel better playing basketball without a shirt on and not having to always wear a sweatshirt to cover up areas of fat that really embarrass them. So it seems to take care of a little area that really bothered you, and it's gone. And there's no scar, you know, it doesn't show. You can't even tell that it ever happened. There's no scar there in exchange. For example, like a tummy tuck, where there's a scar where you cut out skin and fat, which is also great for many other reasons. But unlike a tummy tuck, there's no scar. There's just fat removal.